Diuretics. In general, diuretics accelerate rate of urine formation, therefore removing sodium and water from the body. Diuretics were actually discovered by accident when it was noticed that a mercury-based antibiotic had a very potent diuretic effect. Anyway, the site of action is the kidney, specifically the nephron. Exact site is basically dependent on which drug or class we're talking about. The goal for diuretic is to increase the rate of urine formation, therefore increasing the urine output. As a result, we have more net water loss from the body, which results in lower blood pressure. Indications for diuretics include excess fluid volume, right? Because we want to get rid of extra fluids if we have extra fluids. In addition, it's to help with hypertension because it reduces blood pressure, and it is also used when there's a decrease in renal function to jumpstart the kidney. Patient education. So in general, we want to educate our patients who are taking diuretics pertaining the drugs, the side effects, the importance of weighing themselves daily, right? Because that's how you monitor also how the drug is affecting you, if it's effective, if we're achieving our goals. So an indication of basically removal of fluid is sometimes associated with weight loss. Now, it is also important to make sure we educate them on lab works pertaining to whatever diuretic they're on, as well as timing of the doses. So diuretics will make them go to the bathroom more often to urinate, and therefore it is important to emphasize if you don't want to be up all night, it is actually better to take it in the morning to prevent them from having nocturia and possible injury, especially if they're kind of half asleep and they have to go to the bathroom. In addition, just like with other blood pressure medication, we have to educate them on the importance of monitoring their blood pressure and as well as the drug's effect and side effects, if anything. Also, one thing that's very important is if somebody's on digoxin or lanoxin, it is important to monitor those effects. We're going to talk about digoxin more later on in Unit 3, Part 2, but just to emphasize, digoxin is a medication commonly given for heart failure patients. If somebody with heart failure is started on diuretics that can lower the potassium, this will actually increase their chances of getting digoxin toxicity, because if their potassium level is low, they are more likely to experience digoxin toxicity. Diuretics are classified according to their sites of action within the nephron, their chemical structure, and their diuretic potency. Let's first talk about loop diuretics. Loop diuretics are very potent diuretics. These diuretics actually cause rapid diuresis. So how does this work? Loop diuretics work by inhibiting sodium and chloride reabsorption in the loop of Henle. So that's the part of the kidney tubule where water and salt are reabsorbed. So in this area right here. So by doing that, it will increase water excretion or urination. In addition, it also dilates the blood vessels. So they cause direct arteriolar dilation, which decreases peripheral vascular resistance. So they have renal, cardiovascular, and metabolic effects. Therapeutic effects include potent diuresis resulting in substantial fluid loss. So hemodynamically, loop diuretics decrease the preload and CVP because of its effects. The indications for use are the following. One is hypertension. Next is fluid overload or edema associated with CHF, hepatic, or renal disease. We have to be very cautious when giving these medications to patients with impaired renal function, pre-existing dehydration, pre-existing electrolyte disturbance, specifically hypokalemia, as it can make it worse. Contraindications or reasons why we shouldn't give these medications to some patients. One is generally, this is contraindicated for patients with anuria or a patient that makes less than 100 ml of urine per day. This is contraindicated in patients with chronic renal failure or anuria. It is maybe less effective in these patients, and delayed excretion of drug may increase the risk for toxicity. So there can be drug-induced hypovolemia, which can precipitate azotemia. So this is an increased levels of nitrogen-containing compounds, consist of urea, creatinine, and various body waste compounds. Azotemia signs and symptoms include anuria, confusion, thirst, edema, abdominal pain, increased heart rate, heart failure, and dry mouth. So those are the symptoms to monitor. Anyhow, so again, if the patient has chronic renal failure and anuria, loop diuretics are contraindicated. We're also not supposed to give these medications to patients with untreated dehydration and electrolyte imbalances or disturbances. Lastly, sulfa allergy. Chemically, this medication is related to sulfonamide antibiotics, and some literature suggests that although it is not likely to happen, a cross allergy between those antibiotics and loop diuretics, it's still very important to take note and monitor for possible sulfa allergy related reactions when it comes to giving this medication. Side effects or adverse effects include electrolyte disturbances, most commonly hypokalemia. So how do we know that the patient may be experiencing hypokalemia? We need to monitor for signs and symptoms, which includes leg cramps, tingling, numbness, nausea and vomiting, and abdominal cramping. Now, some other adverse effects or side effects include dehydration, hypotension, dizziness, and with prolonged and high dose, it can cause ototoxicity or the damage of inner ear, which can affect somebody's hearing. Nursing action other than the usual, which includes patient education and so on, it is very important to assess the patient's blood pressure, intake and output, BUN and creatinine, which is basically your kidney function, potassium and magnesium, right? Because those are your electrolytes, especially potassium. We have to monitor fluid volume status by doing ionos and daily weight. We have to tell our patients that when they're trying to get up, that they have to do it very slowly due to the possibility of dizziness because of the volume loss and blood pressure changes. So we don't want our patient to fall or faint because they stood up really quickly. Examples of drugs in this class includes all this, and the one that you have to know is furosemide. So furosemide, it causes potent diuresis and hypokalemia. These are most commonly seen with furosemide or Lasix.